Dr. Bastos is a clinical assistant professor of psychiatry at NYU School of Medicine and a clinical researcher at the NYU Bluestone Center for Clinical Research. He is co-principal investigator, director of palliative care research, and a session guide for the NYU Psilocybin Cancer Anxiety Research Project. He's a supervisor of psychotherapy at Bellevue Hospital, NYU Medical Center, and the co-founder and former co-director of the Bellevue Hospital Palliative Care Service.
Thank you very much. The NYU Cancer Psilocybin Anxiety Study. It's about an event we're all going to face, and that's of death. Many of us will experience anxiety as we approach our death. This study is about trying to mitigate the existential and spiritual distress of people with cancer at various phases. We're hoping that the results will show a reduction in the stress and anguish that approaching one's end can provoke. The results so far look very good. This relief is the Buddha at the end of his life, and that's kind of the goal of the study, that we die with equanimity, with dignity, with peace of mind and peace of heart. It's a beautiful relief. I review some of the existential factors and psychological factors in end-of-life care. And I should add that one of the hats I wear is a palliative care psychologist. And while we've gotten better at chemotherapies and targeting cancer in medical ways, we're still not very good at targeting and reducing the emotional distress that cancer patients go through at any stage of the disease. This is hopefully a step in that direction where the results have been remarkable at times. We'll discuss utility and creation of meaning at the end of life, discuss and define a peak experience or mystical experience, discuss some of the research of psychedelics and mystical experience briefly, talk a bit about transcendence, which is a key interest of mine, and that we'll talk about as it links to suffering and cancer and how transcendence of our suffering, our body, our cancer, of this self into a different ontologic space can really bring about a healing. I'll review our study with you, and I want to close with some vignettes of some patients who I've worked with, where the key factors were their experience of love and transcendence. And so many of our patients talk about this profound sense of love that really heals them, and it's very, very touching. How do Americans die? Despite the fact that 2 Gallup polls found that 9 out of 10 people with 6 months to live would choose to die at home, most don't. Most die in institutions, what we call actually bad deaths. There's a term called good death in palliative care, which is a death that's pretty much congruent with dignity, less anxiety, surrounded by your loved ones. I often ask people, how would you want to die? Where would you want to die? And most people respond, at home, with my children, with my partners, with friends, in a beautiful place, without pain. Sadly, this is how most people die in America. Most people die in an ICU with unnecessary tubes, trying to prolong life for a period of time, where the quality of life, spiritual, emotional life, is obviously very poor. And this is an op-ed many years ago in the New York Times. It is the most avoided conversation in medicine. At medical school, residents and students are taught to do many, many things. The topic of death is still a bit taboo, and it's kind of surprising to hear that. But there's a mountain of literature supporting that doctors still don't want to talk about end of life. There's been some sea changes in the past decade or two with palliative care as a discipline, but there's still some taboos to get through in terms of discussing death. So what are some existential needs of cancer patients? In a study surveying what their unmet spiritual needs were, they said things like overcoming fears, finding hope, finding meaning, finding spirituality and spiritual resources. Items that we find the psilocybin experience can promote, but that are being unmet in most cancer patients. And so palliative care is increasingly focused on these domains of spiritual and existential distress as a key part of the quality of life. This is an interesting study out of Memorial Sloan Kettering here in New York City, and it's quite powerful. High rates of clinical depression has been linked with the desire for hastened death in cancer patients. Depressed patients were 4 times more likely to have a high desire for a hastened death than non-depressed patients. Hopelessness was also linked with the desire for hastened death. But among patients neither depressed nor hopeless, none had a high desire for a hastened death versus 2/3 with depression. We're seeing that depression and hopelessness, when it's on board an end-of-life patient, is linked with more depression, more hopelessness, a desire for an end of life. If those are mitigated or removed, we're seeing a very different picture. So how can we do that? There are some psychotherapies targeting this, but we're hoping the psilocybin model, the mystical experience model, can really promote a radical shift in consciousness that will radically change how one thinks about their own mortality. This is a syndrome we see in some end-of-life patients, a psychiatric state in which hopelessness, meaningless, and distress are the core phenomena, a very difficult experience to have and to witness in a loved one. People diagnosed with cancer complete a search for meaning and emerge with a sense of renewal, greater self-awareness, and personal growth. Viktor Frankl was a Holocaust survivor, but many of his words now are used actually in end-of-life care because he spoke about finding meaning even at the end of life, finding meaning even in the worst of situations, in his case, the Holocaust. But we find that people at the end of life with cancer can find profound meaning and spiritual transcendence and change the way they die. In this quote, which I find very touching, meaning can be found in life literally up to the last moment, up to the last breath, even in the face of death. A few things. The palliative care literature has emphasized a need for a greater focus on spiritual and existential therapeutic interventions at end-of-life care, and there's a paucity of those interventions. Spirituality and existential approaches form the basis for emerging novel therapies to meet this growing need. I think we can consider psilocybin-induced treatment model a novel approach. Spiritual well-being and sense of meaning and peace appear to benefit persons suffering from distress at the end of life. And very important, spiritual well-being and meaning that we cultivate during these psilocybin sessions have been shown in research studies to be a buffer against hopelessness, depression, and a desire for hastened death. We're talking about a very radical shift how people are dying if they have the potential to have this experience. Viktor Frankl again, man is not destroyed by suffering, he is destroyed by suffering without meaning. This is an interesting study. It was a meta-analysis on all the constructs and factors associated with end-of-life, interviewing physicians and patients and family members. And the top 3 items in most studies are things that we hope, and we're finding, the psilocybin-induced session can address. Meaning and purpose in life, and transcendence. Spirituality is one definition that I like. Spirituality tends to be a broader, more inclusive category than religion. It can be defined as that which allows a person to experience transcendent meaning in life, or a personal search for meaning and purpose, which may not be related to religion. This is one very interesting study, again out of Memorial Sloan Kettering. They constructed 2 measures. One was the meaning and peace measure, which was an experiential, empirical experience of meaning and peace. And one was a faith measure, faith in religion and redemption, comfort in their beliefs. And in the end, the construct most linked with the reduction in end-of-life distress was the meaning subscale. And it's not to denounce faith, and faith has a crucial role in our lives, but it really seems that the experience of peace and this profound shift in awareness and consciousness is more important, at least in this study, than faith alone. And Joseph Campbell said it perfectly, I don't need faith, I have experience. The definition of a mystical experience, a sense of unity, a sense of oneness through transcendence. Usually ego identity falls away into a much broader landscape without boundaries. It's been called many things throughout millennia. Paul Tillich's ground of being, or the void, or God, or Brahman, or Christ consciousness, Om Tat Sat. We can go on, or nature. There can be secular terms or spiritual terms, but it's that sense of connectedness to all things, nature and people. Transcending time and space of this consensus reality we all share today in this room. These patients transcend that sense. A deeply felt positive mood, a sense of sacredness, this noetic quality William James spoke about. One of the things we find that people come back from these experiences, it's very hard to articulate what they experienced. They're incredible at writing their experiences down, and we give them a lot of credit in these journals they keep, but so much of it escapes language. Some key foundational books or people. William James, this book was groundbreaking in terms of consciousness and mystical experience. Richard Buck's Cosmic Consciousness, an incredible book. I think one of the greatest books of the last century. It came about the time of William James's book, and he interviewed and profiled people who he felt had mystical states of consciousness. Some famous people, Christ and Buddha and Spinoza and other notable figures, and regular people in his life, including him. He had a spontaneous mystical experience one afternoon, and that triggered this whole line of work for him. Rudolf Otto and the idea of the holy. In this book, a powerfully influenced Carl Jung and his work on numinosity. And Abraham Maslow in the 60s studied peak experiences, the same thing as a mystical experience, a little more secular in language. He said, to the extent that all mystical or peak experiences are the same in their essence and have always been the same, all religions are the same in their essence and have always been the same. They, these practitioners, should therefore come to agree in principle on teaching that which is common to all of them, whatever it is that peak experiences teach in common. And he goes on to talk about this common core spiritual experience of the transcendent experience. There's a wonderful literature going back millennia and, of course, decades, a lot of written literature in the past century. Aldous Huxley was a very, literary person, but he was kind of a godfather to the psychedelic research. In the 50s and in those decades around, it was part of Vedanta Society in California and befriended a lot of the early psychedelic researchers, and himself talked about end of life and the promise of psychedelics at the end of life. Wrote a wonderful book, Island, and, of course, his very famous Doors of Perception. My own experience with Maria, let me go to the last quote. The dying face increasing pain, increasing anxiety, increasing morphine, with the ultimate disintegration of personality and a loss of the opportunity to die with dignity, from his novel Island. Some key studies on mystical experience in psilocybin, a very foundational one by Walter Pahnke back in 1963, which showed that students in a divinity school who had psilocybin compared to a placebo had a mystical experience like the ones found throughout millennia, throughout our religious traditions. Rick Doblin did a follow-up with those surviving people decades later and interviewed them supporting those long-standing results. And of course, Dr. Griffiths and the Hopkins team have done incredible studies replicating how psilocybin can promote a mystical experience as those found in religion throughout time. There's been a call for a better way to work with the dying by many people. We hope that this psilocybin research is a response in a very novel way. These are some of the literature that's come out. Charlie Grobe, our colleague at UCLA, did a 10-patient pilot study with psilocybin end-of-life anxiety, showing a reduction in anxiety. Transcendence of suffering at the end of life. Reviews of palliative care literature on spirituality, end-of-life care, show that transcendence and meaning are the most common factors. That's what we're targeted in a way in these studies. Self-transcendence includes behaviors and attitudes that are both psychological and spiritual. Self-transcendence refers to an expanded self-boundaries and awareness of dimensions greater than self without devaluing the individual. Transcendence, the ability to extend the self beyond the immediate context to achieve new perspectives, is seen as important in the last phase of life, where dying patients are encouraged to maintain a sense of well-being in the face of very close biological and social loss. Even in the midst of suffering, it is possible to create something that is beautiful. We've seen it, which maybe feels counterintuitive, but we've seen people at the end of life have beautiful experiences and change the way they die. This is a remarkable article written by a fellow named Ignu. He got some very important and wonderful creative writers in a room together. Eric Cassell and Kubler-Ross before she died, and Cecily Saunders and Bernie Siegel talked about what does it mean to heal. And so the word healing means to make sound or whole, to restore a person to spiritual wholeness. And it's from the root hal, which is the root of the word holy. So it's very linked to a spiritual word. Wholeness involves physical, mental, emotional, social, and spiritual dimensions of the human experience. And healing is independent, and this is key, of illness, impairment, cure of disease, or death. So we can have a sick body, but we can still be healed, right? But so often in our medical model, they seem linked. And we could separate spiritual health and healing from physical and biological suffering and demise. And healing is the personal experience of the transcendence of suffering. And Kubler-Ross, before she died, said it beautifully: if you become whole again, you're healed. This is a very famous paper written decades ago, not about psychedelics. Eric Cassell is a well-known medical writer and author, and it was about suffering in medicine. And it's a landmark paper. But rereading it as the years go by, it really speaks to the work we do with psilocybin and transcendence. And this is from the original article. Transcendence is probably the most powerful way in which one is restored to wholeness after an injury to personhood, such as cancer. When experienced, transcendence locates the person in a far larger landscape. The suffering is not isolated by pain, but is brought closer to a transpersonal source of meaning and to the human community that shares those meanings. Such an experience need not involve religion in any formal sense. However, in its transpersonal dimension, it is deeply spiritual. Everyone has a transcendent dimension, a life of the spirit. This is most directly expressed in religion and the mystic traditions, but the frequency with which people have intense feelings of bonding with groups, ideals, or anything larger than the person is evidence of the universality of the transcendent dimension. The quality of being greater and more lasting that an individual gives this aspect of the person is timeless to mention. The profession of medicine appears to ignore the human spirit. When I see patients in nursing homes who have become only bodies, I wonder whether it's not their transcendent dimension that they have lost. I want to talk about our study a little bit and then end with some quotes from some patients, some volunteers. We're finishing up this year a study looking at people with cancer, utilizing psilocybin in a one-dosing session. 32 patients was our goal, and we're about to meet that. The primary variable we're looking at is anxiety associated with cancer and end of life. We're using 0.3 milligrams per kilogram of psilocybin with each patient. It's a double-blinded study, one psilocybin session and one placebo session. Each patient has 2 sessions. These are some of the inclusion criteria, which is anxiety disorder linked to cancer and their end-of-life experience. Some exclusion criteria that I won't go through, but severe medical disease linked to the heart, other psychiatric disorders. We're looking at a host of measures from quality of life to anxiety to spirituality to transcendence to mysticism to forgiveness, a whole host of measures trying to capture their experience and how it does change or if it changes after psilocybin. There are 3 phases. There's the preparatory phase, which is very important, and trust and rapport are key. Without that sense of trust and safety and rapport, we can't even advance to the psilocybin session. It has to be there, a sense of safety that anything can happen here. I can go to a place that I can't even imagine being, but I know I'm safe and being held in this room with these people. We talk about their past life, the important people in their life, and of course their response to cancer and their fears about dying. This is not a good sentence setting. Ms. Updike, please hold my calls for the rest of the afternoon. I've just taken some LSD. We try to create a good sentence setting. This is our session room. This is the day of a session, so the patient hadn't arrived yet, but we put flowers in the room and the couch is made into a lovely bed and there's a very lovely rug and paintings. And the session itself, they're encouraged to lie down, evoke a relaxed state, use headphones. They hear music through a soundtrack the entire time. And they're encouraged to go into the experience over and over again in the prep phase. The best psilocybin session, we do nothing. There's nothing to do. How would I ever even begin to approach the place they're in if it's going well? We get out of the way, assure their safety, take their blood pressure once in a while, but we have them go into the experience. If they have distress and want to come up, they can, of course, and we encourage them, no matter what's coming up, even if it's frightening, to move into it, and it's likely that something will change to something different. And the last phase is the integration phase. That's very important, where we spend weeks integrated in talking about what actually happened and making sense of it for them if there are indeed loose ends that don't make sense for them. This is a great team, some former and current members. It's an honor and pleasure to work with Steve, Ross, and Jeff Gus and Gabby, our project managers. We have a wonderful team at NYU doing this research. Albert Einstein, I assert that the cosmic religious sense is the strongest driving force behind scientific research. I couldn't agree more, Mr. Einstein. A quick vignette. This is a woman in her 50s with breast cancer. It was actually in remission, but her anxiety was crippling. She was unable to function for fear of recurrence. She lived with this persistent fear of recurrence, and everything was tainted by this anxiety that was overwhelming. Her experience was really about love and this profound sense of love that was everywhere. She's an example of moving into an experience that looks a little dark and frightful. When she began her session, she began to cry and shake a bit and say there was something very dark and big and ugly in front of her that she later thought was her cancer, her tumor. And she was encouraged always to go into it, to move into it, to move into it, do not move away from it. And once she did, it all changed. And she had this incredible, long experience of love and being, of changes everywhere. That's why these are her quotes. It's all change. I don't feel anxiety anymore about dying. I am everything. Everything is me. I have found it, no need to look any further. It was timeless. I'm not afraid. Every instant is eternity. Right now I'm free. Right now I have no fear of recurrence of cancer. That's remarkable in a woman who couldn't function. It does not enter my mind. These are quotes from her after the session. Everything is love. The Christian mystic Meister Eckhart spoke about timelessness, which we hear a lot from our volunteers, of there's no time, they transcend time. And Meister Eckhart said, there exists only the present instant, a now, which is always and without end is itself new. There is no yesterday, nor any tomorrow, but only now, as it was 1,000 years ago, as it will be 1,000 years hence. I want to discuss briefly a gentleman I work with who's a beautiful young man in his 50s. He has since passed away, and he was remarkable in his courage and in his experience. He had a very serious cancer, obviously, and he was a journalist, and the cancer and the chemotherapy was both very difficult for him. And he entered the study and had a powerful, what I would call a full mystical experience, and he experienced an incredible end of life and a death that you don't see often, with such dignity and peace and without anxiety study, that it's touching to see. And he attributed it to this study and to the loving support of his beautiful wife. He called it life-changing, the experience of love, nothing I've experienced before. This is a man with a lot of life experience, by the way. His quality of life has dramatically improved. We asked volunteers to go home and write about their experience. He came back with a beautifully 4-page written, typed vignette. From here on, love was the only consideration. Everything that happened, anything and everything that was seen or heard, centered on love. It was and is the only purpose. Love seemed to emanate from a single point of light. It was so pure. The sheer joy, the bliss was indescribable. And in fact, there are no words to accurately describe my experience, this state, this place. I've known no earthly pleasure that's come close to this feeling. No sensation, no image of beauty, nothing during my life on earth has felt as pure and joyful and glorious as the height of this journey. I felt warm, but pleasantly so. There were examples of other religions around me, American Indians, Mother Earth, Hindus, Christians, and others. Not necessarily people, just the thought of understanding of other religions, all circling around the same source of energy, all focused on one thing. There was an understanding and respect for each other's challenges and efforts to get to the same place. I was beginning to wonder if man spent too much time and effort at things unimportant, trying to accomplish so much, when really it was all so simple. No matter the subject, it all came down to the same thing: love. Earthly matters such as food, music, architecture, anything, everything, aside from love, seems silly and trivial. All our countless and never-ending attempts to get to the source are overproduced. We put too many notes in a song, too many ingredients in our recipes. I was convinced in that moment that I had figured it out, or it was figured out for me. It was right there in front of me: love, the only thing that mattered. A brief death he experienced during this session. I was aware that in a sense that my earth life had stopped. I was now presented with an opportunity to get close to the source of light and vibration. Everything was peeling away, object by object, molecule by molecule. I approached what appeared to be a very sharp, razor-pointed piece of stainless steel. Had a razor blade quality to it. I continued up to the apex of the shiny metal object, and as I arrived, I had a choice to look or not look, over the edge into the infinite abyss, the vastness of the universe, the eye of everything or of nothing. I thought about cancer. He had tumors in his lungs. I took a tour of my lungs. I could see some things that were matter or feeling the inside of my lungs. I recall breathing deeply to facilitate the seeing. There were nodules there, but they seemed rather unimportant. I was being told, without words, to not worry about the cancer. It's minor in the scheme of things, simply an imperfection of humanity, and that the more important matter, the real work to be done, is before you: love. Undoubtedly, my life has changed in many ways I may never fully understand, but I have an understanding and awareness that goes beyond intellect, that my life, that every life, all that is in the universe equals one thing: love. And he had a beautiful recovery, and even though he passed away sadly, it was just an incredible, dignified death. Cicely Sanders, the hospice founder, says, "You can find a degree of wholeness as a person whether you get better or not, whether you are suffering or not. And I certainly have seen people finding a wholeness as they die." Cancer patients can benefit from psilocybin sessions because there's a shift in awareness, a strong ontological shift, like no birth, no beginning, which our patient talked about. Almost like the Zen mystics spoke about: no beginning, no end, no birth, no death. If there's no death, then how can I suffer? Improve emotional well-being, improve capacity for nature, improved acceptance and peace with death. Kubler-Ross: if you become whole again, you become healed. Nothing is faster teacher than suffering. The more we suffer, the earlier the spiritual quadrant opens and matures. Both these patients and many of our others have experienced profound love. When this gentleman finished his study, he saw a tree of life, and he said the movie reminded him of his psilocybin experience. And when it was over, he sat there crying, looking at the screen. It was about love. A quote from the movie: "The only way to be happy is to love. Unless you love, your life will flash by. Love everyone, every leaf, every ray of light. Forgive." I happened to come across the broader version of that by Dostoevsky that I think Terrence Malick got his words from. And here's the full quote: "Love every leaf, every ray of God's light. Love the animals, love the plants, love everything. If you love everything, you will perceive the divine mystery in things. Once you perceive it, you will begin to comprehend it better every day. And you will come at last to love the whole world with an all-embracing love." In closing, we began with the relief of the Buddha. These are said to be the final words of the Buddha. "Do not grieve. Even if I were to live in the world for as long as a kalpa," which is a long period of time in Buddhist language, "our coming together would have to end. You should know that all things in the world are impermanent. Coming together inevitably means parting. Do not be troubled, for this is the nature of life. Diligently practicing right effort, you must seek liberation immediately. Within the light of wisdom, destroy the darkness of ignorance. Nothing is secure. Everything in this life is precarious. Always wholeheartedly seek the way of liberation. All things in this world, whether moving or non-moving, are characterized by disappearance and instability. Stop now. Do not speak. Time is passing. I'm about to cross over. This is my final teaching. And in closing, when this patient began his session, as the psilocybin, I think it was psilocybin, we're blinded, began to take effect, the first thing he said with tears coming down his cheeks was, birth and death are a lot of work. Birth and death are a lot of work. It was touching. And it reminded me immediately of this saying that we say in the Zen monastery in the evening about death and birth being important. And I want to close with the Zen evening gatha. Let me respectfully remind you, life and death are of supreme importance. Time swiftly passes by, and opportunity is lost. Each of us should strive to awaken. Awaken. Take heed. Do not squander your life. Thanks for your attention.
Thank you.
I'd like to ask you how you feel gender, race, and culture really impacts both the interpretation and the discourse related to this research.
We're going to have to see. We're going to have to look, after your study's done, issues about gender, culture, but clearly our cultural foundations and groundwork influence our experiences. But the mystical experience found throughout millennia has been unbound by culture. I mean, it really is it transcends culture. But I guess at this point, the answer would be, when we're done, issues of gender, childhood experiences, religion, culture, and how they affect the outcome would be interesting. We haven't looked at the data yet, so I can't fully answer that, but I think it would have implications.
Is there any studies being done out in nature?
It seems it would be, obviously, and people probably have done that throughout the centuries. But it wouldn't be a safe environment for a controlled study. So we're really providing a set and setting, set being the mindset of the patient, the volunteer, and the setting being the room, controlled, where it's controlled medically and emotionally, and it's so crucial. Clearly, could a session happen in a beautiful nature surrounding? Obviously, it would be a lovely experience. But in the research world, these are really it's so important to have these strict boundaries and to have these parameters in place that are consistent with research since the 50s. And I should add, for folks who I kind of ran through a lot of the data. Some folks don't always know this. In the 50s and 60s, before all the controversy and the countercultural shifts and all that, there was a lot of research being done with end-of-life cancer with psychedelics. Peer-reviewed, serious academic, medical center-funded research. Throughout America that was seen as respectable, and a lot of known people who weren't sick would take it and speak about it. People like Cary Grant, who said it changed his life. It's a very respected kind of phenomena. And then, of course, in the early mid-60s, with all the craziness that went on, we lost a valuable tool. Anyway.
Usually, these high dosages, they present a strain on the body. So I was wondering, for cancer patients that have gone heavily chemotherapy or pharmaceuticals.
We'll work with people with very frail bodies. Psilocybin is a profoundly safe drug in that way. We've had no serious medical side effects, adverse effects, nor of the other studies in the country. But it is, the first part of the experience can be very turbulent. The first part of a psilocybin experience, the first hour or two, or a little more or less, can be kind of somatically a little upheaval and rough. And, we kind of, in the preparatory stage, talk about that with them. The first part may be a little difficult, and it will change. It will shift to something very different. Spaceship going through the atmosphere, and it's shaking you up. Then once you get there, it's nothing but calm. But we haven't found that people with medical disease or cancer have been unable to do this. But it's a great intuitive question. But back in the 50s, they were doing people with doses with days to live, and they were fine. So, ruling out any severe cardiac health that might be causing arrhythmia or certain things, we're not finding any adverse effects. And people come into the study often very frail, close to advanced disease.
As these therapies for end-of-life care get more integrated, are you concerned about some sort of pushback from organized religion?
Yes, I'm always concerned about everything.
I expect so.
We remain, constantly concerned. To do this research is one big, concern. But we haven't felt the pushback yet. But it clearly enters a space of what is a mystical state? No one is saying, and I would never say it's God in a pill. It's, but I even say often, and Bill Richards always says this, and I got it from him initially, these aren't drug studies per se. I mean, the psilocybin is activating, obviously, a state of consciousness, but the mystical experience has been around since the birth of, humanity, and for millennia, we think most traditions of religion were founded about a mystical experience, and then got, changed throughout the decades and centuries. So we're discussing a mystical experience, but yeah, we haven't had feedback yet or pushback, but we'll see. But we're not judging religion by any means, and we're supporting any religious experience people have. Secondly, I'm sorry, Dennis.
Well, one of the criticisms I might say is you can't reduce, you're reducing this to neurochemistry.
Oh, right.
You're studying this like a scientific phenomenon, which it is. I mean, we agree. But
we're also not. I don't see it as a reductionistic, biologically fMRIs only. I think it's an experience in a qualitative way that transcends neuroscience. So I'm in the camp of, it's crucial to understand what's happening within the brain, but that is an experience that we need to explore and understand. It's been happening throughout millennia. That, it would be hard to measure that, but we can measure the outcome. We may not be able to measure the phenomenon, but if somebody has less anxiety and a more peaceful death, then the outcome should speak volumes, I hope.
How did you administer the psilocybin, and was there a difference of that, of how physiologically the patients were able to...
It's administered through a pill that looks like the placebo exactly, so we're all blinded. So it's a small white pill, as is the placebo, and they take it at 9 o'clock in the morning. It's about a 6 to 8 hour experience, and they go home at night. But it's through a pill. And Huxley did, yes, he asked for it. Actually, many people know this story. On his deathbed, he injected LSD. It's an interesting story. When he passed away, his wife was with him, and it was 1963, and she came out of the room to tell all the friends who were in the living room that Aldous had died. And when she came in the living room, everyone was watching the TV. And she was, how rude is this? Aldous just standing there watching TV. I don't understand why. JFK had just been assassinated, so he died on the same moment that Kennedy was killed. And anyway, little vignette. But yeah, it's a pill. And anything else? We see nausea in that early phase I spoke about, that difficult 1 to 2 hour period. Nausea, some rumbling, like I might throw up. No one in my care has thrown up yet. I don't think we've seen any vomiting. Jeff, no vomiting on your patients here, right? No vomiting. So just nausea, but we have a boulder just in case, but no nausea. But again, that 1 hour of just a little unease. But again, they're instructed and they're kind of trained in a way so well to go with it. And the more you go with it and let go into it, it changes. And I think it's a lesson for all of us who are living also without disease, that mindfulness of the moment changes the experience of the moment. So mindfulness of even anxiety and of anguish changes the anxiety and the anguish to something different. It's being present. To be fully present seems to heal. And I think psilocybin, aside from its ontological shifts in consciousness, allows people to be fully present.
Are these issues we are dealing with, i.e. mystical experiences, are they purely a question of neurology, or is there something more involved?
Yes. That's above my pay grade as well. Clearly the brain is involved, obviously, and we need to understand the brain science, obviously, but I think in the end it's an experience that might transcend brain understanding. We need to know what's happening in the brain, clearly. Something is triggered, but these experiences happen spontaneously to many people throughout millennia. So what happens during a mystical experience? People have these peak experiences, as Maslow spoke about, throughout life. In nature, being in love, rhythmic dancing. There's so many ways to have peak experiences, not as sustained as a psilocybin experience. So yes, obviously we need to understand every bit we can of the brain science, of the neuroscience, but I also think there's going to be a piece that is going to be left to, if I can say, left to the mystery, because we're entering a space, I think, that religion tried to address for forever.
Anthony Bossis, NYU, thank you so much.
Thank you, Neil. Thank you.
Thank you.